That's one. Say, I got it out of my system. Now, if you're going to change more than one question, you have to prove it to yourself. So whether you think I'm there, your friends, your attendings, your colleagues, yourself, if I'm going to change an answer from A to B, B to C, because originally I chose A, I have to find evidence in the question stem that I didn't see before. That's a legitimate move. It's like, all right, well, I'm in the hospital practicing and my doctor goes to me, Stavros, why are you going to change your answer? I have to prove to him why. I have to say, well, you know what? I didn't see about the shock. I didn't realize he had low blood pressure. I didn't realize that he had high temp. I didn't realize that his physical exam, he had issues, he had consolidation. So by seeing something I didn't see originally, change the answer. And I'm telling you this because I know most of you are doing this, and you have to stop changing answer choices, because if you keep changing your answers, you are going to not do well in the actual test. Because I'll give you another example. I have a step 2 student that went last week. Prior to a step 2 going in, she was changing about 10 questions per block on her practice tests. I'm like, doctor, what are you doing? All this hard work, 7 months of studying, you're changing right to wrong. I know a lot of you have the urge to change. Do not change your answers. I promise you, if you look at all the statistics that you have in your Q bank, chances are you're changing right to wrong more than wrong to right. I promise you. So I hope you realize I put emphasis on this, because you can study for 5 months, 7 months, 10 months, a year and a half, 2 years, no problem. The minute you're going to start prepping to take this test, you'll realize second guessing, overthinking, right to wrong, and I promise you, you're going to eventually realize all this hard work is either going to produce success, or you might just keep changing your answers. All right. Let me see. There was a question here. Dr. Carolina, my eyes are a little blurry. All the exam or clinical cases, step 1. So yeah, so for step 1, mainly you will never get first order questions, very rarely. It's basically, most of them are going to be asking what the diagnosis is, a lot of pathogenesis, a lot of MOAs. So if you want to understand exactly how they look like, Amboss and you are the top 2 Q banks. If you really want to get a taste of what the exam is, you can go take the 120 online and see how you score. That's basically the step 1 exam. Step 2 is all clinical cases. It's all management, next step in management, next step in diagnosis. But for step 1, I need to report this also, because I got this brought to my attention again to confirm that A, a lot of pharmacology, a lot of MOAs. B, I'm not sure if you're using Amboss or not. I'm not sure if your world has it, but have you guys, give me thumbs up, yes or no. Have you done questions in your Q bank that literally are doorway information questions, meaning it's not a scenario. It looks like a doorway info, patient's name, HPI, PMH, past medical history, past surgical history, review of systems, right? All that stuff. Then you have physical exam. Then you have labs, and asks you diagnosis, okay? Like a patient chart, yes. So patient chart, SOP, whatever you want to call it. Amboss has it all by 100% because I've seen it.